I believe it was Kensington Medical Clinic was the first clinic that we worked with, Jordan's clinic. They were seeing 800 phone calls per day, and they're able to reduce that down to zero inbound calls, which is a pretty extreme transition and might not suit every practice. But you can see the potential of how much impact that would have on the availability of staff. Just by adopting appointment reminders, if you haven't already, this can reduce your no-shows from, in some cases, we've seen 14% no-show rate in a really bad case down to 5%. Sending a file to the patient from the EMR with email, you have to download it from the EMR, upload it into your email inbox, copy paste the patient's email over, and now that file is being sent to the patient after all those clicks, and it's there forever in their inbox. It's an attachment, which just isn't actually HIPAA compliant. We've often seen doctors able to send their own messages with forms faster than they can assign the task to a staff. So they're actually doing something that someone else used to have to do in less time. I remember at Kensington, the waiting room was very full of people, and now they have a kiosk, which is a little screen where the patient is able to check in, complete some intake forms, and they're issued a number. So, and their number is shown online, and they're able to see when they need to come in. So they can go and do their banking, they can go over to the strip mall, and they don't need to be sitting there. So they're happier, and the waiting room is less crowded and safer. In some cases, 80% of patients are actually going to your website on their phone. It's almost always more than 50%, and it's in some practices it's 80%. And what that means is this website on the left, it's probably not mobile optimized. There's a good chance it doesn't work at all on a phone, and it's quite common. So this sounds like a basic thing, but because it's so impactful, that patient is just going to end up phoning you and tying up your phone lines if they can't find their information because your website isn't mobile responsive. One thing that we started doing was capturing the preferred pharmacy of each patient at the time that they book their appointment. And by doing that, we know that it's a particular shopper's, it's the one on Cambie and not on Main Street, which might be difficult to suss out in the middle of the appointment. And that prescription is going to go to the right place with no effort.
Probably the doctors will save at least an hour a week by kind of clicking automations rather than actually clicking tickler, typing out a long message to the staff where they can necessarily do it themselves. And then also the staff see a lot of a less burden on themselves, and you're kind of able to scale the clinic up from there. So like in the last probably, let's say 5 years or so, we've had maybe 5 to 7 physicians come on with us, and we haven't had to increase the staff load or increase the amount of staff we have in the clinic because a lot of the automations are taking away the burden from them.
And I would add to that, like you kind of have to compare it to the cost of adding MOAs, right? And so if your MOA is like $30 an hour, in versus just implementing a software solution, which saves a lot of that time and rethinking how those workflows in your clinic are going. And so, you can either have 3, 4 MOAs, or you could have 2. There's days where I'm just working solo, seeing patients from home and have no MOA on. And so I think that's the real cost saving here is you're automating and making your practice style more efficient. So you're not having to spend it on administrative staff expenditure.
These tools are, we've seen that they're actually quite positively received by the MOAs because the portion of the work they get rid of that gets automated is actually the portion that the MOAs don't want to be doing anyway. Like they didn't really aspire to a career of answering the phone and doing data entry when those are the least interesting, least desirable parts of their job. So the reception from the staff that we've seen has been surprisingly positive.
The minute we kind of put online booking and reminders and stuff in place, we probably saved about 8 hours a day. So essentially 1 staff member per day worth of work. So we were able to either reassign them and get caught up on something else in the clinic, or basically work with a bit of a lighter team at the front. Patients are so used to going to either self-checkouts or anything like that, so they are able to go through the terminals themselves. Most people keep their care card on them or have it memorized these days because they're so used to using it, whether it be for online booking or any other reasons. So overall, I would say the adoption to the terminals are probably 97, 98%. I mean, every now and then you get someone who wasn't raised with any sort of technology background, and you help maybe 1 in every 20 patients or so check in. But overall, throughout the day, if you're seeing 200, 300 patients, you're only really helping 10 or 15 people.